The kind of hot topics are things called patient-specific implants and instruments, which is where we use imaging like CT scans and MRIs to measure people's bone and look at the shapes of their bones, and then make implants and devices we use to implant the knee or hip replacement based on that particular person. And just about every company has that available, and people use it to varying degrees just based on, again, the patient's anatomy and whether there's some reason that you really need that extra assistance. There's also robotics that is starting to come out into the orthopedic world that's been in the general surgery world for a while now. We're starting to use robotic arms to do things like to help us make the cuts and shape the bone so the implants fit well.
Welcome everyone out to Fairview Park Hospital. We're here with Dr. Gary Daniel. You may recognize Dr. Daniel, cardiologist here.
Yes, sir.
Okay.
So it was previously Dublin-Macon Cardiology. That's when, obviously, when Dr. Vega, who was here for many years, was over the practice. And once we sort of integrated into the practice, it's now South Georgia Heart and Vascular Associates, which is sort of really part of Georgia Cardiology is sort of our Macon office. So we have a Macon office and a Dublin office.
A lot of resources to draw from. We've seen that from Fairview Park Hospital. We see it from you and your team there. And so we want to talk to you today, with February being here, being American Heart Month, and it's a time to turn to really heart health. And, at this day and time, Doc, you would think that 2022, people would really be in tune with how to take care of their heart, but we're some hard learners, so to speak, sometimes, aren't we?
Well, yeah, I think part of it is, obviously, we live in an industrialized society, so when we talk about diet and exercise, I mean, we have seen smoking rates decrease tremendously in this country, so that's led to, some decrease in heart disease, but on the other side, with the obesity epidemic that we face, that obviously leads to more diabetes, and as you see more diabetes, you see more heart disease.
Yeah.
So, even despite COVID and cancer, heart disease is still the number one, cause of death in this country.
Yeah. And doctor, the areas of the country affect the way people eat, the way people live, lifestyles, and you know this area well, don't you?
Absolutely. So, we try to talk to our patients about the typical Southern diet, and I don't try to get them to completely abstain. I try to get them to modify. I think if you try to get people to just stop doing something they've been doing for many years, that's going to be very difficult. So usually when patients ask me about, diet, I first try to approach portion control. And that way you still get some of the things you've always had. And then slowly, if you can start to cut carbs, which are obviously the biggest issue for most of us.
Mm-hmm. Yeah. I mentioned just earlier that you knew the area well. I wanted to make mention that your family moved here back to Rents, I believe you said, when you
Yes,
were about
sir.
10?
So my grandparents both sets of grandparents are from here.
Awesome.
Dad grew up here, mom grew up here. They got married and moved to Detroit. My dad was a auto worker at Chrysler, and then I moved back here when I was 10 years old. Wow. So I grew up here, went to school here, and didn't stray too far, undergrad at Georgia College and medical school at Mercer, and then went off to train, and then after I finished my training, then I came back.
And doctor, people really like, especially here in South Georgia and Middle Georgia, they like to kind of know who they're seeing, know who their doctor is, and like to be able to relate. So I just want to bring that point up so people would know you're invested in our community. Your grandparents, you grew up here, you know this area, you're part of our community.
Absolutely. Still have family here. Still, when I'm here on the weekends on call, I still see family members. And so certainly I feel like I do have a vested interest in the community, and certainly we want to see our community do well in terms of heart and vascular disease.
Yeah. So heart problems, heart issues, it's very important as we go along, obviously, to visit the heart doctor. If we have an issue, we have hereditary issues in our family. That's a large part of the issues that people have, though, is it not, Doc?
I do think, so when we say heart disease, I try to generalize that to heart and vascular disease, cardiovascular disease, because, it's not just heart issues anymore now. When we talk about heart disease, we're really talking about cardiovascular disease. We're talking about not just the heart, but the vascular system as a whole. So we're talking about people with heart attacks, we're talking about people with heart rhythm issues, congestive heart failure, but we're also talking about people who have strokes. We're talking about people who have poor circulation to their legs. Those are things that I think go hand in hand. 50% of people who have heart disease also have vascular disease, meaning that if you have a blockage in your heart artery, you also have about a 50% chance of having a blockage either in your carotid artery to your brain, which could lead to a stroke, or a blockage in your arteries to your legs, which, unfortunately can ultimately lead to amputation. So I think that we should address the heart and vascular issue as a systems approach.
And so, Doctor, it sounds like the holistic, I guess, would be a
I think it's
term that's
important.
thrown
Yeah,
around.
so when I talk to patients and what I try to explain to them is if you have a blockage in your heart or if you have a blockage in your leg artery or in your carotid artery, we can fix those blockages in terms of removing plaque and putting in stents, but that's not really what our long-term goal should be. A long-term goal should be to prevent plaque buildup in your arteries. That's when we talk about diet, exercise, if you're diabetic, controlling your blood sugar, if you have high blood pressure, controlling that, if you have high cholesterol, making sure we control that. Those are the things that cause blockages to begin with. If we can control those things, those are called risk factors for heart disease. If we can control your risk factors, then we can ultimately control how much plaque buildup that occurs.
Yeah. Doctor, I would think that you would believe in exercise as being very important.
It
as
is,
heart health.
absolutely. So
People are extreme sometimes with exercise. A lot of us under the mentality that it's all or nothing kind of thing. But there's a very popular thing out now of just movement, of how important movement is. Would you speak on that and where you stand on it?
sure. I sort of take the same approach that I take with diet. So when I talk to patients about exercise, I think it's important to not go from 0 to 100. If you've been somebody who's been relatively sedentary, when you start to exercise, if we can get you just to walk 20, 25 minutes a day for 3 to 4 times a week, I think that that's a huge improvement over no exercise at all. If you can gradually increase that, then I think it's fine. But I approach it just like diet. I don't think you can go from having a poor diet to a great diet all in one day. These things take time. As I tell my patients, these issues did not occur overnight, so we're not going to fix them overnight.
Yeah. So, Doctor, we look at the last 2 years, and we look at what COVID has done, and we see different things in the news. We get different impressions on how COVID has affected. Obviously, the lungs has been a big part of it, but does it put that much strain on the heart, or what can you tell us about it?
Sure. So again, I say it's not just a heart issue, it's a heart and vascular issue. So when we see COVID patients, first let me just circle back. I think it's really important to recognize people who have had, in the healthcare field, who've had the most impact for us, and that's first responders. I mean, I think that's a huge deal for what they've done. People in the emergency room, people in the ICU, people on the floor. As a cardiologist, we see COVID patients quite often, but it's typically after they've been triaged and treated, and by those people, and I think their role is certainly much more important than what I do. But just speaking to COVID and its effect on the cardiovascular system, typically when we get a call about a COVID patient with a heart or vascular issue, it's usually a blood clot in the lungs, which I'll usually get a call regarding that. And it's someone who's developed a blood clot in their lungs from COVID. Sometimes we just put them on blood thinner, and that's enough to take care of it. Sometimes they'll ask me to go in and put a catheter in to try to dissolve the clot. If it's a large amount of clot, we'll consider that. They can also get blood clots in the veins and arteries of their legs. They'll ask us to address those issues sometimes. And then sometimes it can put a strain on the heart in terms of just people having increased metabolism from COVID, being sick from COVID. If you already have underlying heart disease, that can make the situation worse. And so then we'll be called to address those situations as well.
Are we seeing long-term effects as far as what we can tell this far from severe COVID cases or from moderate COVID cases?
What we've seen mostly is the long-term effects on the lungs, scarring of the lung tissue, and that usually translates into long-term shortness of breath and oxygen use for those patients. We still see those patients long-term. I think we don't have enough information yet about long-term effects on the heart from COVID. There have been some effects in terms of what we call cardiomyopathy, which is a weakening of the heart muscle from COVID because it is a virus. And you can have that almost from any viral illness. But long-term, we still don't know yet how COVID's going to affect our hearts.
Yeah, and most people are having rehab after that.
Correct. So we'll see patients that need rehab. They're sort of debilitated from it. I've seen younger patients still requiring the use of oxygen after having COVID. So it's certainly had some long-term effects on the lungs, the heart. I think we'll see more as time goes on.
Doctor, myocardial inflammation, what is that? Am I saying that right?
You are. So it's typically called myocarditis. That's a situation where you'll get inflammation of the muscle of the heart, and that can occur from really a couple of different ways. Typically what happens if you get a viral illness, so the virus infects the body and can also affect the heart, it's the immune response, it's your body's immune response to the virus that can certainly cause a myocarditis. And it could be pretty devastating. We've seen some cases where people have died from COVID myocarditis. They've contracted COVID, and then the body's immune response to the coronavirus has led to damage to the heart muscle. Those patients have profound congestive heart failure and shock, and they can die from that. The other situation where we've seen it is there's been a select group of people, usually young male teenagers, who have gotten the vaccine for COVID and then have had myocarditis from that. Those patients, as far as I'm aware, have had no deaths in that situation. It's a fairly self-limited type inflammation of the heart from the vaccine. Those patients typically fully recover.
Dr. Danny, you come in, you are really taking over a practice here. You're offering cardiac help to our community. And so what would you like to say to the community? What are the goals of your profession here?
Well, first I'll say I wouldn't necessarily say taking over. I want to say that the people who are in the practice already, I feel more like I'm joining them. They have 3 great nurse practitioners there. They have tremendous front office staff, medical assistants, and I feel like I'm more of an addition to the practice than taking over the practice. What we want to do is just try to continue serving the people of the community in terms of cardiac and vascular care. We've tried to make a seamless transition. It's been sometimes difficult, not from a patient standpoint or a patient care standpoint, but mainly just from technical issues, IT stuff, things like that. And so what I would say is be patient with us. I think that the influx of patients that we have seen has been a little bit unexpected, appreciated, but certainly unexpected. And trying to deal with that, increase in volume of patients that we've seen has presented some, technical difficulties for us, but we're trying to get adjusted to that. So what I would say is just be patient. We're here for you. We're certainly here to serve the community. We're happy to be here. I will say I've been here for 11 years, so this isn't sort of a new thing for me. It's just a different location, a different staff, and now more patients.
Doctor, also in February we celebrate Black History Month, and in our community we really try to do a good job in covering the events and speak specifically to Black Americans, to the health issues that face Blacks that are maybe more higher risk of heart disease and such as that, please.
I think that the risk or detriments that African Americans face from healthcare issues are certainly a part of a larger issue in terms of, education, finance, society type issues. Most of us, if we could afford to eat, healthier, we would. And I think that's a large part of it. I think that we know that in terms of education and our ability to have affordable housing, those are things that affect our overall health.
Yes.
Now, in regards to specifically heart disease, obviously we are more susceptible to things like hypertension, congestive heart failure, kidney failure. I do think that there's some socioeconomic factors involved with that. So if we could obviously improve those, I think we would see long-term health improve. But in addition to that, I think that we have to be vigilant about going to the doctor, getting checked, taking our medication, addressing these issues as they come up. I think it's important to note that we are more affected by diabetes, and I wanted to specifically speak to diabetes because I think that's a real issue, not only in America at large, but specifically in the African American community. I think if you could pick one thing that I think is having a sort of a negative impact on the healthcare of African Americans, I would say it's diabetes, because of the multitude of end organ damage. And when I say end organ damage, diabetes has a role in congestive heart failure, heart attack, stroke, kidney failure, amputations, blindness. I talk to my patients, and it's interesting that when I came here, I thought my role would be primarily as a quote unquote cardiologist, but I probably do as much vascular work as cardiac work. And part of the reason for that is diabetes. Diabetes is the #1 cause of preventable amputations in this country. And so who's most affected by that? It's lower socioeconomic groups, particularly African Americans. So that's one thing that we can, I had just a conversation with a patient of mine this week, and we talked about diabetes and the effects of diabetes on, various organs in the body. And so we really have to get better control of that, and that's diet and exercise. And so all these things are interconnected. And so what I would say to, our African American community, my African American community, is I think certainly access to healthcare is important. Once one has access to healthcare, utilizing that access to healthcare, getting routine screening, checkups, and when problems present themselves, go to the doctor early to get them addressed.
Doctor, what are some early signs? What are some things that we should look for in our body that would indicate there may be an issue coming along?
So from a cardiac standpoint, what we typically see is patients, obviously, probably the most, the thing I see the most is patients who present and think they're having acid reflux or indigestion, and I couldn't tell you how many people I've seen that were having what we call angina or heart pain and thought they were having acid reflux. Sometimes it can be difficult to tell the difference between the two, but that's certainly something that I would consider as a problem if someone's having recurrent chest discomfort, especially if it occurs with exertion. Fatigue, excessive fatigue, shortness of breath, especially shortness of breath that occurs at small distances or a flight of stairs, waking up at night short of breath, swelling of the legs. Those are things that suggest that the fluid status in our body is certainly not where it should be and should be addressed.
How about specifically on diabetes? What are some signs, some things that one would see on their body?
I think that by the time you see signs of diabetes, you sort of are well advanced. But the first thing I say is fatigue or blurred vision. Those are two of the things that suggest that your blood sugar levels are quite high. Typically in a situation like that, are excessive thirst, excessive urination. Those are signs that one may have high blood sugar levels.
Yeah, they should make an appointment right away, should they?
Absolutely.
Yeah. So, Doctor, we know on the upcoming event here for the Dublin Lawrence Black Festival Committee, we have a health fair coming up at Oconee Gym. That'll be held on February 12th from 10 until 2 p.m. And
I think anything we can do to, spread, more information to the community, I think that's always a great thing.
yeah, and it's wonderful that we're able to have health fairs like this. So it's an ideal opportunity because a lot of us don't like to go to the doctor, but we like more information. It's just setting that appointment a lot of times.
Yes,
But
we're all guilty of that, myself included.
Yeah, but that first step is so very important. So we invite you out to that health fair for sure. Doctor, we thank you for taking time out today. I'm glad we got our schedules together and able to sit down and let people know who you are, where you're from, and what you do for our community. And we trust that everything will go very successfully for you here. We appreciate what you're doing for us.
It's been my pleasure, and we plan to be here, and appreciate all the support that we've gotten, and I just want people to know that we're here to help.
Thank you, Doctor.
Thank you.
Here at Stepping Stone, you are never alone. If you or someone you know has been a victim of child abuse, please call our fully confidential crisis number at 478-595-8339.
The City of Dublin Natural Gas provides the most cost-efficient source of energy available today. So for your home, choose the most natural resource. Safe, clean, efficient. All new subdivisions around the Dublin area have natural gas available. Start reducing your energy bills today with Dublin City Natural Gas Department. Natural gas, the smart choice. Call 277-5048 today and let us help you start saving today.